Good afternoon, everybody. Thank you for joining our third edition of the Intas Petpod webinar series, the online continuous education series from Intas Animal Health team. So it is our pleasure to give you a very warm welcome to this online scientific update platform from Intas Pharmaceuticals Limited. I'm Anand Kanojia. I'm representing the companion animal healthcare business of Intas, and it is my great pleasure to connect with all of you across the country through this platform. I think the time has changed, and with a new normal coming into the place, small animal practitioners are probably going through a very whole new set of the challenges, particularly to keep themselves very much updated about the science and the knowledge. We identified this need in the month of April when the lockdown started, and then we thought that why not to come up with a digital editions, digital platform where we can keep all of you, all our esteemed veterinarian clients to be engaged with us, and we can continuously pour a lot of new knowledge, new sciences, and ongoing practices in our veterinary small animal practice world. So we in TAS, we again thank you for giving and sparing a time today. The program has already started, and we can see a lot of new registrations still coming in. So welcome all the new joinees. We can see that there are people from the country and from outside the country also. And the strength has been quite encouraging. It is looking almost more than 1,500 as of now. So all the viewers, once again, very warm welcome to this program. Intas, as a leading and responsible animal healthcare player, we stepped ahead with this webinar initiative under our Petpod banner. This Petpod is basically going to be a digital services available on an online YouTube's, on a podcast, on a digital reading format. It is coming to you in various ways. And we want to constantly enrich this initiative to keep you digitally very much updated and bring you the best of the small animal practice science world. And under this program, we particularly focus about the canine and feline medicines, particularly the sciences, which includes surgery, very different topics like telemedicine, dermatology, and many more. I think many of you joined in the first program, and you remember we started with the telemedicine because it was a very important topic at that point of time when the lockdown began. And now then we move to the most popular subject, that is the dermatology, which touches each and every veterinarian. And now digging further in the dermatology, we are going to talk about the surgical aspects and the therapeutic aspects of the otological conditions in the dermatology. Dermatology is a vast subject, but talking about the surgical aspects in the dermatology is something really advanced. And that is where we are going to discuss this topic today with all of you. And with this, we are going to take a subject, a topic through one of the wonderful speaker we have today, Dr. Lakshmi Ramana from Hyderabad. We welcome her, and she's going to speak about the clinical advances in the therapeutic and surgical management of the ear affections. Particularly, there are more than 8 surgeries if we know in the canine, and she would be discussing some of the possible outcomes of the surgery. She has a lot of material to share. Before we go to the formal opening of the program, let me take privilege to introduce to all of you about Dr. Lakshmi. Dr. Lakshmi Ramana, she runs the animal care clinic in Hyderabad, Banjara Hills, one of the best area to visit. And she's the founder director of the same clinic. And I know her personally for almost last 10 years, a very passionate veterinarian who started the private clinic in the South India. And we say that she is the first lady, Indian lady, to start the South Indian private practice. And she got the award, the Pet Care Canine Excellence Award, PACE, in the field of basically maximum contribution given by private practitioner to the veterinary profession. She has been attending a number of symposia, seminars, workshops to keep her updated, and very, very passionate, very, very knowledgeable. And about her, she does not require much introduction, but she has equally basically, she excelled in the academic. She has been a gold medalist in the Masters of Veterinary Science, followed by similar excellence in the field of small animal practice. She has been an animal welfare officer with the RSPCA. She has been in part of the Animal Welfare Board, the Blue Cross towards implementing the ABC programs. She has been the treasurer of a Blue Cross of Hyderabad. She has been joint secretary of PFA Hyderabad and Secunderabad. She is also a member of committee for the ABC AR program from the GHMSC. She is a member Indian Society of the Veterinary Surgery, life member of ISCP, and the contributor to the ABC manual to the Animal Welfare Board of India, as I say. Dr. Lakshmi has been working a lot about the dermatology, particularly on the surgical aspect in her multi-specialty hospital. And she's with us today. So I think all of you are very much eager to listen a lot from her. The program is going to be of almost 45 to 50 minutes, followed by question and answers by our technical team, who will be carrying forward this program. Before I hand over the desktop to her, let me request all of you to visit us at the YouTube Intas Petpod channel. This channel is available for you. You can just type Intas Petpod in a YouTube. Just go through the videos because we upload all the programs, online webinars here. You can, and do not forget to subscribe because almost every month, twice or thrice, we update this site and we put a lot of material for our viewers. So we have just inaugurated it today itself for you, and the channel is available to you. And do not forget to subscribe. And if you like the video, please share your like. You can forward to your community, and the program will be becoming more and more intense in the days to come. So I wish you a wonderful listening from Dr. Lakshmi, and thank you so much for your patience, for your time, and we go here with Dr. Lakshmi. Over to you, Dr. Lakshmi. Please join us. Welcome.
Hello, hi. Everyone, hello everyone. Good afternoon, and thank you for joining us. Thank you, Mr. Kanodia. It's been a real pleasure. I've always been, associated with Intas because of the quality of the products, and which is required. And it's the price suits the Indian market. And they're always innovating new things. And it's an honor to be, doing a webinar for you. Today's topic, of course, is about ear diseases. And Dr. Nagarajan had, earlier in part one spoken about the medical management. And today I'm here to speak about, the surgical management. So I would say this is like part two of ear disease. Because finally, sometimes when, we need to use a combination of both medicine and surgery to be able to achieve our goals. It's, not two different subjects. It's after all one, animal body, and we need to do what it takes to get the animal better. Okay. So here I am, so this is a short video, and I'll be also sharing some videos about some of the trainings that I've attended this here too. Is it visible my screen? I need to see. Yeah. So this is effective and management of ear diseases, mostly the surgical intervention. Okay. So in the etiology, we see, as atopic dermatitis and otitis. See, ear, of course, is the skin extends everywhere, and in the skin it extends even within the ear, as we know. And the ear is innervated, with mostly so many nerve endings along with the eyes. And as it is even with us, when we feel allergy, we feel itchy in our ears, itchy in our eyes, right? It's because of the fact that it's a sensitive organ. It's one of the organs of senses, and it's highly innervated with nerve endings, and for which, along with it, also starts of problems like it tends to get inflamed. And the etiology could be because of food allergy, It can be because of ear mites. It can be because of foreign bodies that are stuck, like small little piece of say grass, or certain sticks and all that go in. Of course, you can also have some mass in the vertical ear canal, which will go unnoticed if you don't look in, and you can always have pus coming out, and nothing will really help it. And of course, other skin disorders can it can exacerbate in ear disease, like say for example, hypothyroidism is one that they have looked at, pemphigus, some of the autoimmune diseases, they all show up as ear diseases. And the damage to the migration of the epithelial migration, so skin disorders, and the reason, predisposing causes. So what is it that makes these animals get, not every animal has ear diseases, but what is it that makes it cause? So stenotic ears, some breeds like Sharpeis have known to have really tiny ears. The ear canals are really tiny, and they start off with really tiny ears, and some of them have got excessive ceruminous glands in the skin, and we would say, our cocker spaniels, poodles, these are, dogs that have, in fact, poodles have the excess hair in the ear canal. Ceruminous glands, you can see a lot of cocker spaniels having this sort of ceruminous glands in the skin. And of course, there are a lot of our dogs which are say water dogs, or gun dogs, like our Labradors, golden retrievers. They love swimming. They see water and they splash into the pool. And years of dogs are not designed to take water getting in. So there will be water getting in, and of course, it's because of gravity, water gets in. Sometimes it can make things worse by increasing the moisture inside the ear canal, and changing the microenvironment, and predisposing it to fungal or bacterial infection, whatever it may be. And very importantly, damage of the mechanism of epithelial migration. Now, this is something that's to do with physiology. There's a problem with healing. Okay, some dogs they've discovered that have a genetic disease. They sometimes either it is genetic or acquired. Okay, and acquired happens, sometimes when there is a injury to the source of the epithelial migration, that's the tympanum. And of course, contact sensitivity, maybe some of the ear cleansers, people overuse ear cleansers in the ear, and you're allergic, they're all chemicals, some of them are allergic to those. And people may use oil, oil, some of them may put some other things in oil, ajwain or whatever it is, and then they start cleaning the dog's ears, and those can cause, contact sensitivity, of course. So we're straight jumping into diagnosis. We all know these things. Physical examination. I mean, I know all of us have to go back to the basics. This cannot be overemphasized. You have to examine it physically, by otoscopic, generally looking at the anatomy of the ear. You need to take samples you need to take swabs, you need to take cytology. I also encourage people to take, biopsies of the skin. Of course, a culture of the, or the exudate that's coming out, but as you know, most antibiotics, when given systemically, as Dr. Nagarachan had pointed out in the last lecture, because the ear canal is in the bony labyrinth, is in the bony part of the that is the horizontal part of the ear canal, is in the bony area of the skull, and that's where the infection kind of festers. We may not see antibiotics, external, I mean, that is systemic antibiotics working, but of course, you can use, local antibiotics. And otoscopic examination, either by handheld or video otoscopy. And radiology and CT. These are the ways we can find out, diagnose, to see whether, is it only a ear infection? And of course, is there secondary issues there? Are there polyps, or what is the status of the ear canal? So it is required for us to go through all of these, these diagnostics, for us to be able to confirm our physical examination findings. So we do rely a lot on physical examination as our basis of treatment. Now, it's really important for us to understand, how the ear is made. So it is, of course, as you see, it's made out of cartilage and skin. And you have the cutaneous marginal pouch and the apex, and this is called the scapha, as you know, and the dorsal part of the helix, okay, and the caudal part of the helix. So this is very important for us to see. When we see this, we are so used to this, as veterinarians, we look at it, we get so used to seeing these things, but sometimes we do not register in our brains to say, okay, this is this part of the anatomy, that's that part of the anatomy. And why I'm talking about anatomy is because basically I'm a surgeon, and all of us are surgeons. We are taught to do surgery, and that's where we're heading. And it's important for us to know the anatomy, of the ear canal. Now, I would talk about physical examination that you've seen, but I'm very interested in our handheld otoscopic exam. It's really important, for us to have a good otoscope, okay? Because that's something that very easily you can put the scope in. It's not enough to just open the ear and to peek in. You need to go deep in, because as you know, there's a horizontal and a vertical, thing. And usually, I've brought my otoscope here. So this is, the big otoscope that is there. As you can see, it's, with a large, you know, large pointed. So this is for animal otoscopy. You do need this for larger dogs. If you can all see this. Okay, we need this. This also got an area, where we can do sampling. We can put, a biopsy forceps in or a swab in to pull out samples from. Okay. We can also use the regular human otoscope for smaller dogs. And actually, you can really, see even the horizontal ear canal with a little bit of, manipulation. And what are we looking at when we're doing the hand and otoscopic exam? We're looking for patency or stenosis. So as the ear canal becomes more and more inflamed, the healing, and with every insult, I would say, and every healing, there's a lot of fibrosis that forms, and that causes the ear canal to get narrow. And that changes the microenvironment within the ear. Okay? You also will look at the color changes. You see whether the proliferative changes, ulcerations, exudates, foreign bodies, parasites, tumors, excessive or hair or waxy accumulation. Okay. So I've got, this is the way, of course, I'm sorry. I think I've got the wrong video up here. Let me see. This is the cytology video. Okay. Excuse me. Yeah. I'm sorry. I have to put, there was another video that I wanted to show you how we do the hand and otoscopy. I don't think it downloaded well. I'm sorry. This is about the swabbing, cytology. We take up a swab from the ear, put it on a slide, one slide every year, heat fix it, stain it with, our either methylene blue, the cheapest stain available, or even diffuse stain, and then go ahead and look at it in the microscope. So here's the slide here. You put in the cover slip onto that. And then it goes on into being stained. And then we can go into have a look, inside to see what is there. Okay. So that's, of course, it's by high field, 100x is what we look at. And so your oil immersion, and then we look at it. It's a very simple technique to do. Everyone can do it. All you need to have is a fairly good microscope. Okay. And that's what we require to have a look. Oil immersion is what you need. Okay. And you see, and you look at the cytology part of things. Okay. And the other thing is video otoscopy, okay, for which the animal needs to be sedated and anesthetized. You need to have them in lateral recurrency, and this is also diagnosis as well as treatment. Here, I really want to impress upon, video otoscopy. Okay. So I will show you, a video that is there, which we can pick up. Excuse me. I'll show you the video in time. And so this is the video otoscopic findings which are there. So this is a normal ear canal. As you can see, you should be able to see, these blood vessels. Very important for us to see blood vessels when you're going in. And here you can see some amount of excessive wax. Okay, this you can see sometimes. So this amount of wax is excessive. And this also is a backseat plug that is sitting on the tympanum. Okay, and this is finally you should be able to see the tympanic. This is a normal otoscopic examination of a dog. Okay, where you may have a little bit of wax sitting in there, and you can see a clear tympanum here. You can see the the handle of the malleolus, as well as you can see the raphe here, and you can see through transparently. And here, this is the normal appearance in a cat. Cat will have hardly any hair and hardly any wax. Okay, so there's a difference between a dog and a cat findings. Okay, so here you are, normal tympanum of a dog and normal tympanum of a cat. Okay, some abnormal findings that you see. Okay, here you will see some erythema, as you see. Here, excessive wax accumulation. And during during allergy, you will see this sort of swelling. Okay, when there's allergic dermatitis or even allergy, allergic otitis, you will see this sort of swelling that you will know that there's an allergic alert. And here this is stenotic ear canal. As you can see, this is really narrow, and this needs to go for surgery. Okay. The other way to find out, about infection is or ear disease is by radiology. And what are you looking for? Are these bullae? As you can see, this is a middle ear, and the ear. This should be radiolucent. Okay, and positioning of the animal is really important. So this is a regular general lateral view. As you can see, they have opened out. So this is a closed, and this is an opened out jaw view. This is under anesthesia. And here, can you see the way they have put the collimation? And here underneath this is a bit of a sponge that is kept so that the head is parallel to the table. Okay, the head should be held parallel to the table. So this is where sponges are used here as wedges to keep your head parallel so that you can get a normal X-ray like this. The other view is the ventrodorsal view with the closed mouth, VD radiograph. Here again you can see the temporomandibular joints as well as the tympanic bullae. So this is in fact the ear. You can see the ear canal. Very clearly you can see the ear canal, and here should be where your bullae is. Okay. So since it's so this is a the normal projection. Now this is your open mouth, okay, positioning, okay, and in which you can see the bullae much better. See, yeah, and the same here, open mouth, okay, which is positioned at a 30-degree oblique, so that you can find out, you can see the two different bullae, not so that they're not superimposing. You can make out which one is the near one and which is the far one. Usually the far one is the one that's is bigger, that's closer to the table. The near one is the one that's smaller here. Okay, so that's it. And then pathological changes. So what you should see is clear here, air-filled tympanic bullae. And when you see this infection, you can see the radio opacity. That means there is infection, and you may need to go for further diagnosis. Okay. Of course, you can use CT also. CT is the best method to know, and this can make out. For example, you can see this tympanic bulla, which is bulla tympanum is, filled. This air filled, and this is not air filled. You see the difference in the. So very easily you know that this ear is infected. Okay, this ear canal is infected. Okay. I will try to play, a video of the. One second. I have a video to show you about the video otoscopy. It is on it's on just a second. Let me just leave this. Sharing. Okay. Okay, yesterday it was working. Okay, let me see how to do that. Okay, pardon me. I'll show you both all the videos in the end of the presentation. Okay, so for the treatment, okay, the treatment of the primary and secondary cause is either by medical management or by surgical intervention, and ear flushing and meningotomy, JEPS, ear canal resection, and lateral and ventricular osteotomy in dogs and cats. So this is what we go for. Okay. So medical management, of course, you need to treat the underlying cause, treat the secondary ailments with deep ear cleaning and flushing with saline, and appropriate ear cleansers like Anvi-Flush, inserting of the ear drops where a deep tube into the ear. I'll show you a video about this. Local steroids and antifungals and antibiotics, acaricides are required, and systemic steroids and antifungals are also needed. Okay. Let's see this one. So here, this is a very useful technique we have, which we have, I was taught how to flush the ears. Okay, so here we have, the ear flush, and I have a sterile syringe here. We are loading up the flush solution. And see, this is just a feeding tube which we have length cut it out. Okay, and we see an approximate length right from the jaw till the end to know how much to put in, and then we go flushing, deep ear canal flushing. Okay, so this results in a lot of cleansing action. Okay. And with this, what happens is, we can make sure that there is the medication goes right in, and and it's flushed out. And after 10 minutes, you can instill the drops via the same method. So this we advocate a lot for our clients to take home. We give them a new set, a bottle, and after we find out what organism is there and which ear cleanser and which antibiotic or antifungal or medication can be given, we send them home with the ear flush. We teach them how to flush the ears out and send them home. And this we have seen has worked very well, because it's important that the medicine reaches deep into the ear canal. Okay. So the main thing is how to know if the dog has got otitis media and interna. Okay. We can see otitis externa, by otoscopic examination. But otitis, recurrent otitis externa may be the only clinical sign that's associated, okay, with otitis media. And otitis media is uncommon in dogs with acute otitis externa, but it is very common with chronic otitis externa. So when you see animals come back every time with infection, start suspecting otitis media. Okay, and the way you know it is, of course, by video otoscopy or by radiography, as I've seen you. Okay, so otitis media is the inflammation of the middle ear. Okay, and the presence of an intact tympanum membrane does not rule out that otitis media is not there, because the tympanum, as you know, can heal. They can heal within 1 to 2 months. Okay, there may have been a ruptured tympanum, and the infection could have gone right in, and then the tympanum could have grown back. And otitis interna is your actual deep ear infection, where your bullae, your cochlea, vestibule, semilunar canal, those are the ones that are infected. Okay, that are inflamed. Okay. So otitis interna occurs as a direct extension of the otitis media. So externa can become media, media can become interna. Okay. So it's very important for us to understand about the otitis media and at the bulla and be able to treat it before it becomes a otitis interna, which is extremely painful because these are your actually your organs of hearing and balance, and it's extremely painful, you know. So here is the anatomy of the tympanum. Okay, this pars flaccida. So when you look at a tympanum, okay, this pars flaccida, you will have seen that there was the swelling of the pars flaccida. This inflammation clearly shows that there's some allergic disease. Okay, and this is the malleolus handle of the malleus that we call as the stereo of the malleus. And once you see the tympanum with an otoscope, you should see these vessels. And with these vessels, you know that this is tympanum is a healthy tympanum. If you do not see these vessels, then it's a chronically inflamed tympanum, and even if it's closed, you would know that there's probably some underlying maybe otitis media happening. Okay. So where do you do a meningotomy? How do you get to a media? Okay. So this is your pars flaccida, this is your pars tensa, okay, and this is your malleolus. You see this. So avoid this area. You should be, if you draw a line, across here, you should be below. You are working only in this area, 30% of this area. And this is where you will actually look at it with the video otoscope and do meningotomy. Meningotomy is done simply by a long pointed needle. Now you do have platinum tip needles, meningotomy special needles, but you don't need it. You really have to just point it out with a sterile, even a spinal needle, which is little, shall I say, malleable, and go. And here you need to understand. See, this is your bulla, okay, and this is the septum of the bulla. And in dogs, the septum is not complete. In cats, is complete. Okay. So this is your tympanum, and this is your middle ear or the internal ear, malleus scapes, and it leads into your internal ear or teres interna. Your cochlea and everything is sitting in here. So you're going in actually in this area to get into the tympanic, into the bulla, for you to go for releasing the pus from here. You can use plenty of drugs and solutions that may be used to flush the ear canals with a ruptured tympanic membrane, and this is a list for you. Okay. For example, aqueous penicillin, you can use ciprofloxacin, endofloxacin, fluocinolone, micronazole, okay, nystatin, ofloxacin, silver sulfarizing. This works very, very well. Okay. And tris EDTA. So many of these solutions, our ear cleansers, like Amiflush with tris, has the capacity. You can, even if it is ruptured, pretty safe for us to use for cleansing of the ear, the middle ear. Okay, so you use the same flushing method that I showed you and try to cleanse it out, but better still is to go with the video otoscopic cleansing. Okay, I'll show you. I really want to show you both the things. Let me see if I'm able to take this up. I will go for a smaller screen. 1 second. I'm going to take the help of Dr. Ravindra here. If you'll excuse me, because I'm trying to share the same video that I had earlier, which I had shown yesterday.
Okay.
Dr. Ravindra, how do I get to close this window and get to my
in that case you need to close the screen sharing.
Okay.
And again you can share the screen.
Okay, fine.
With the video.
Yeah. Right. So I will stop. Do I stop the video here, Dr. Ravindra?
Just not the video.
The full screen.
Yeah. Right? Now you reshare the screen with the video.
Yeah, I'll open my sorry. I need to get to my CD player, Dr. Ravindra. How do I do that?
You will just open in your laptop and just share. You need to back to our Zoom platform
Okay,
and
okay.
just
Yeah, I get it.
share screen again. Yeah.
I get it. I get it. I get it. Yes.
You can run the video first and then share the video.
Yeah, okay, fine. So, are you able to see the screen now? Is it showing?
Yes, ma'am. Yes,
Yeah.
visible.
Great. So, I did a course with Dr. Rosichak.
Management of otitis externa and otitis media requires a clean ear. Waxy debris in ears may serve as a source of irritation, a nidus for infection, and may also prevent medication from getting to where it should to be most effective. Deep ear cleanings are indicated in a number of scenarios. Foreign body removal, where debris accumulation has been significant, or if the foreign body has perforated the tympanum. Significant debris in the external canals that persists within the ear in spite of ear flushing at home. In the presence of severe purulent otitis externa, where Pseudomonas is suspected, to remove potentially cytotoxic debris and evaluate the tympanum. And in the presence of significant debris within the middle ear, in association with otitis media. A high-quality video otoscope provides the unique ability to see fine details within the ear while doing deep ear cleanings. The operating channel of the scope allows for the use of multiple cleaning modalities, including fluid infusion, suction, and the passage of various instruments such as grasping forceps, biopsy forceps, ear curettes, or cleaning brushes. Dr. Rod Rosichuk at Colorado State University has been treating ear diseases in dogs and cats for over 30 years.
I think the advantage video otoscopy provides for us is that we're very clearly able to visualize, for instance, those plugs of material, the ceruminals, for instance, that are present deeply within the ear. And you sometimes don't appreciate or as significant as they really are just through a conventional or handheld otoscope. That material has to come out of the ear as part of your management of any otitis, and if it's left there, it actually becomes a perpetuator of problems in the ears.
The video otoscope makes use of an endoscopic imaging system of the same type that is used for other endoscopic procedures, such as gastrointestinal endoscopy or laparoscopy. The basic components of the imaging system are a camera, a light source, and a video monitor. An optional digital image capture device can be added to the system and facilitates the recording of pictures and videos that can be used for the patient's record and for discussion with the client. Compact imaging systems are also available that combine the camera, light source, monitor, and digital capture device into a single box. In addition to the imaging system, a specialized irrigation and suction device, such as the Vet Pump 2 shown here, can make deep ear cleanings faster, safer, and more effective. The irrigation and suction bottles of the Vet Pump 2 can be conveniently mounted on the back of the endoscope cart. The video camera head and fiber optic light cable are attached to the otoscope, which contains an integrated 5 French channel. A fluid line can be attached directly to the lure lock connector of the channel to run fluids into the ear. This opens up the canal and keeps the distal lens clear. For more controlled flushing and suction, a catheter can be used through the channel, such as this 5 French polypropylene urethral catheter, which has been cut down to the appropriate length. The catheter can be attached to the handle of the Vet Pump 2, and then passed down the working channel to direct high-pressure flushing and suction to the specific areas of concern. Other instrumentation that can be passed down the channel includes forceps for biopsy and grasping, The grasping forceps are particularly useful for removing foreign bodies or clumps of non-growing hair. Brushes are used in some cases to gently clean.
You'll get, we have a little clogging on this little fold, this luminal.
Continuously flush out.
Material has to come out of the ear as part of your menu. And just covering most of the ear midway through the horizontal.
I'm sorry.
And continuously flush out debris while using other instruments. To maximize the effect of flushing and suction, the Vet Pump 2 catheter is used through the channel while continuously running fluids.
There's a huge wow factor associated with folks that have seen video otoscopy for the first time. When they come into the veterinary clinic, the opportunity to actually see the changes that are present in the ear, to be honest with you, even to see a normal ear and a normal eardrum is exciting for them, simply because they never see that area. And of course, seeing the pathology is very enlightening for them, simply because in the past with conventional otoscopy, they hear what the veterinarian describes, but they have no concept in most instances as to what those changes really are. So they're very, very impressed. All right, Anissa, what we're going to do is a little examination of the ear now with our video otoscope, and this will allow us to look all the way down through the ear canals down to the eardrum. And you'll be able to see this as we take a look at the screen, but I won't be able to actually describe these changes to you too well and point to them while we're doing the exam, because we want to be in and out of there pretty quickly. So what I'm going to do is take some pictures as we go down through the ear canal, and then I'm going to bring those pictures back up again, and we'll look at them together, and I'll tell you whatever changes are going on in there. We're in the intertracheal incisor.
As you can see it so beautifully, you can see it.
Vertical canal.
I took a course with Dr. Rosichat,
The horizontal canal was
and it was really a revelation.
We're going to take a picture midway through the horizontal canal, right here. And then we're going to take one more looking at the tympanum area.
See very clearly, you know, the wax.
After the otoscopic exam is completed, the doctor reviews the findings with the owner.
What we see, actually, the canals look quite good in this ear, all the way down to the eardrum area. But just in front of the eardrum, we now have a large wad of wax, basically too much wax, that is covering most of the eardrum in this ear. So this is an excessive amount of wax compared to the other ear.
And so this is how deep ear cleaning works. It's really good.
Just as we do any deep ear
And
cleaning,
once you clean up really deep ear cleaning for animals, you can see that the medicines start working better.
We're just now looking down the vertical canal, and when we do use the video otoscope again, looking in the ear, very important that we pull the pinna up and vertical away from the skull, and by doing so, you'll see that it minimizes the luminal fold, this luminal fold that normally hangs down from the dorsum of the horizontal canal. Keep in mind that everything is upside down now. Now, as I pull up on this pinna, you see how this fold right here, fold right there, is minimized. The fold is minimized. So then I can move into the horizontal canal. And as we get into the horizontal canal, and one thing you'll see is you'll get, we have a little fogging on this scope surface. I never accept that and try to work in the face of that. I'll always bring my scope out very quickly, use alcohol here, clean off the tip, and then go back into the ear. So as we move into that horizontal canal, we see we have a ceruminolith down here sitting in the horizontal canal. And basically, what we're going to do as far as starting our procedure is do a little cytology on this area. We know by swabs in the past we've seen malassezia, the vertical canal, that's what we can see by swab. In this instance, we want to see what we can find that is way down in the ceruminolith. Sometimes it's different than what we see in the vertical canal. Actually, the beauty of the video otoscope here is that we can actually see beyond this ceruminolith. And on the left-hand side, at least my left-hand side, we can actually see the pars. This is not as full a canal as we thought it was. By conventional otoscopy, I thought that this canal was totally full of debris, and it really isn't. So the first thing we're going to do is just some cytology. We'll pass a 5 French urethral catheter in here through the working channel. Let's try to get some of that fluid debris that is adjacent to this material. And then we're going to put this on the slide. And we may do a little squash prep on that. So now we're going to turn on our fluids and run those into the horizontal canal. Just see what it does for this whole ceruminal lift. In this case, it hasn't moved it around too much. Sometimes it certainly does more than that, but you can see now it has opened up the canal a bit, and you can
further down
see
there.
that tympanum to the left much better than you could before. It's a testament to the fact that, one, it allows for clarification of your visual field, just running fluids, and it also opens up that canal so that we are able to manipulate better in the ear. So what I'm going to do with this ceruminal lift, actually this one, I think what we're going to do right off the bat is just reach in and grab this one. We're going to add an extension unit. Now the little extension unit allows us 2 portals to work through. One portal allows us to basically run fluids, and the other portal allows us to do manipulative work. So we're going to first of all put our fluids down. We'll run those so we keep a nice clear field throughout. And we'll start those fluids then. Okay. That's going to keep our scope clear, allow us to visualize well. And then we're going to reach in there. Grabbers while running fluid works very well because if you loosen things up, the debris comes right out of the ear as well. Here we go. The grabbers are in. This is usually a 2-person procedure for this. Oh, there we go. There we are.
Yeah,
We are out.
there. That's the thing. So back to my presentation. Yeah. So you've seen about the deep ear cleaning. Okay. Now I would also like you to talk a bit about the physiology of the ear canal and why it's important for the deep ear cleaning. Because what happens is there's something called epithelial cell migration. Okay. This was an experiment that they had done with Indian ink. They had put it on the tympanum, and this is the way in a couple of in about 2 weeks they saw how the cells are migrating. These are the keratinocytes that are there that have taken up the India ink, and over time, within 2 weeks, you can see from the tympanum to the outward. This is a self-cleaning mechanism that the ear has. Okay, to push out with the cells, the dirt. And here you can see very clearly the tympanum, the pars tensa and the pars flaccida. Okay, and many times when there's an infection, when there's a disease of the tympanum, or when there are other diseases, then you have that there's the failure of the epithelial migration. Okay, this happens when there's a hole in the tympanum, because this is where the cells start migrating. It is from the pars tensa, that's from here that the cells start migrating from the tympanum, migrating outwards, and if there's a hole here, they will stop migrating. So if there's a perforation of the tympanum, it can cause delay in the healing of your ear canal. Okay. Also, of course, it means that there's infection in the middle ear. And of course, colistomas. You can have dogs here. For example, this is where it stopped. This is with dogs which have got a colistoma, which have got other systemic diseases. The same epithelial cell migration may not happen, and when there's so much of debris sitting there, unless we clean this up and we start helping, it's like really you have to look at it as a wound that is not healing. You are allowing, this is like an ulcer on the wound, and this is like disease of the wound that you need to help to heal. Okay. Now, Now, and comes the surgical treatment. Okay, which I do resort to when the deep ear cleaning and after meningotomy and after flushing out of the middle ear, even if that doesn't work, and the dog has got a head tilt, we will resort to surgical treatment. Okay. So again, anatomy is very important, and the place of the anatomy that's most important for us to look at is this intertragic incisure. Okay, this is the most important, the tragohelic incisures. These are the and the lateral crux of the helix. This is the medial crux of the helix. Okay, so this one, this helix is your scapha, and the helix is your cartilage that is holding up the ear. Okay, and this is important because we need to anatomically visualize where to make our incisions. Okay. Now, what are the, so I am looking at it in a more anatomical way. So as you can see, this is the tragus, this is a vertical ear canal, and this is your horizontal ear canal. And from here, it becomes the annulus starts, and your skull starts off here. Okay. So here is the intertragic incisure, and this is your tragus. Okay, and the medial crux of the helix. Okay, and the lateral crux of the helix. This is the helix here. Okay, and this is our, and usually this antitragus is the one that keeps coming up, and this is what while examining the ear with your otoscope, this antitragus, the tragus, this is what you pull up and goes out of the way for you to have a look visually. So now comes the at the deeper ear canal. This is helix still. This is spine of the helix, and this is your conchal cartilage. And then here starts your annular cartilage. And so these are many cartilages put together like a flower almost. It starts like with your annular cartilage, okay, and then your auricular cartilage, okay, that is your your conchal cartilage, okay, and here is your crux of the helix. The helix starts off here, which is actually holding up the scapha. So this is your support system of the ear. Okay, and this is what you are going to be cutting through, this cartilage, when you are doing any of the surgeries, any of the 3 surgeries that we commonly do. Okay, and these are done particularly, I do like of course, and it leads into the middle ear, and this is your bony part of the ear canal, that is your middle ear, and sitting in here is your internal ear structure. This is where the tympanum is sitting, and it goes to. Okay. Now I really like, though this has been not very, I feel they should be more often used. One of my courses that I've done with in the US, Dr. Ellison, who is my guru for soft tissue surgery, he kept on this is a really old method, lateral ear canal resection. All of us have learned how to do it, but I think we are doing it really less, because what happens is this part of the ear, when you open out the vertical ear canal to the horizontal ear canal, it allows more aeration, because here is where the stenosis mostly happens. Stenosis is where the vertical ear canal is maximum, and this changes the microenvironment within the horizontal ear canal. So lots of dogs, for example, he was citing an example of cocker spaniel, litter of cocker spaniels, that all of them had ear infection all the time, and everyone was attributing it to the floppy ears. Yes, they do play a part, but not every cocker spaniel has ear disease. And what they did find out was, that the ear canal had become, quite narrow, and it was quite stenotic, and all they did was ZEPS, resection, and the entire litter of cocker spaniel puppies. I mean, they were, in fact, the entire family had all the brothers and sisters, and all of them became okay. So you don't have to go for anything, you don't have to go for lateral bulla osteotomy or any of these things. All you need to do is probably start with the lateral ear canal resection. Okay? And so I think we should do this surgery more often. Okay? Rather than jumping in. Here, really important is, as I told you, the lateral tragus as well as the anti-helix. This is your area of the incision site. And as you know, this is of course in all the standard textbooks. It's a pretty standard, that you mark off, you take half of this ear canal. You say if this ear canal measures about an inch, then you will take half an inch more. Okay, mark site or the vertical ear canal. As you know, we will be taking off the skin and then cutting the ear cartilage. And please pay attention to a really good pair of scissors. Okay? And try to always, so here the ear canal gets pretty narrow. As you can see in this, I wanted to impress upon you. See, this is where we're starting the incision. And as they're going straight, you see the ear canal becomes pretty narrow. And if you are putting a pair of forceps in here and allowing that to guide you, you're going to get very narrow here. So I don't have stopped putting, forceps here, forceps as a guide. I have started, just using it to make this incision and then guiding it further so that I keep away. I'd like to keep away rather than go inward. Keep away, and because you would like to open out, otherwise this tip becomes so narrow. Sorry. I'm sorry. Yeah, this tip becomes so narrow that you fail to make this sort of flap. This becomes very narrow. So one word of caution, use a very good pair of scissors and keep away, keep away. Don't cut inwards. Our tendency is because the ear canal become narrow, we start cutting inwards and then you are landed up with this very tiny, bit of the cartilage that is there. And unless you fold up the cartilage to form like a gutter here, like this is like a tuft, so that your discharges which are coming out do not irritate the skin. So this is an important part, that you need to pay attention to. And of course, after that you can suture it up, and it's a pretty straightforward procedure. I'm sure all of you have done it once, and I do impress upon that the need for doing this more often. You can save and and this way also you can aerate the ear canal better, and you can instill medication. This does not mean that you stop treatment. Here you can do better treatment. Okay, you can make sure that the medication is instilled here and the owner is able to do this effectively. Okay? The other thing to do is a vertical ear canal resection. Okay, this vertical ear canal resection is done when there is or the vertical ear canal is infected maybe with a polyp, and you want to open out the horizontal ear canal. Okay, so with your otoscopic examination, you will find out, okay, that there's maybe a polyp, and all you need to do is remove the vertical ear canal and make an opening here. Okay, so that's the way you do this. Okay, suppose infection has gone up to the middle ear, then you're going to go for a tica LVO. That is total ear canal ablation and lateral bulla osteotomy. Okay, so a T-shaped incision is marked, and I like to make my T here rather than here, a little above, so that it takes away all of these folds and it becomes really nice and smooth. Okay, and of course, this is the end here. I'd like to make the incision where all the foldings are less, so that it gives a nice smooth ear canal. Here you need to warn the owner that there is going to be a drop here, because your entire support structure, as I told you, the concha and the helix are being removed completely. You cannot expect your pinna, that is the scapha, to hold up. Okay, kindly inform the owners that there is going to be a drop in the ear, the fold, and at the same time there's also going to be a reduction in the capacity for hearing, because as you know, the ear canal acts as a resonating organ to take the sound and amplifying it and up to the tympanum. And here the resonating organ is gone, as well as the tympanum. Okay? And extremely important to know, to follow that once you do a lateral bulla, that you are cleaning up the lining of the bulla. You have to take, a nice curette, put it in, and really burr or clean up, all the lining of inside of the bulla. Otherwise, the infected material is going to stay there, and the entire purpose of doing the surgery is not going to be solved. And of course, here they put a drain, which you can put in, and you can also instill in some pain medication within the drain. Okay, you can do local pain management because it is a pretty painful surgery. Okay, so this is done mostly. LBOs are done for dogs, and VBOs, ventral bulla osteotomies, are done for cats. It's pretty simple. You can feel the, where the bulla is when you lay the cat down. This is done because this is the septum and the bulla is complete. Okay, so so this is the thing. So I've come to the end of my presentation. Mr. Patel, Dr. Patel.
Yeah.
Yeah. Dr. Patel.
Thank you.
So,
Yes.
So I was here just trying to stress the need that, just don't depend on medical management alone. Put the otoscope in. It's a very useful tool. Put it in, and also I rely a lot on my flushing. The flush, as I told you, to take home with the syringe and the appropriate flush material. And talk to the owner about the possibility of surgery, at least a ZAP surgery, for you to be able to solve, the aortic problems, to be able to instill medication, and it may to maybe avoid going in for the deeper surgeries like the TICA LBO.
Right. Thank you very much, madam.
Yeah.
We thoroughly enjoyed your presentation on clinical advances in therapeutic and surgical management of ear affections. The session was very informative. I personally find it very interesting, especially the surgical aspect of ear affections. So just bear with us for a few more minutes to have some question and answer round. Madam, today we have witnessed the third Intas Petpod live webinar. And to our viewers, we are very glad to inform you that now Intas Petpod webinars are now available on YouTube channel. Our YouTube channel name is Intas Petpod. So those who missed our earlier webinars can now see all those webinars, and also this webinar will be available on our channel within a couple of days. So please subscribe Intas Petpod channel. Press bell icon to get varieties of technical sessions from our expert Indian and international speakers. Madam, we are today witnessing over 1,500 viewers. Wow. And we have received a lot of questions regarding ear affections, ear management, and surgical interventions. Practically, I do understand that it is very difficult to attend all the questions. So we urge our viewers to stay connected with us through our YouTube channel. We later on podcast this question and answer sessions on our YouTube channel as an audio podcast. So now we'll take a few questions which is in the common interest of all viewers. Yeah. So madam, I request you to elaborate a few of questions asked by our viewers.
Sure.
Yeah. So the first question is how the ear mites means elaborate something on ear mites in the cats, the treatment and role of steroid in ear infections.
Yeah. Yeah, that's a very important question. So, like I said, to diagnose ear mites, of course, an otoscope also you can magnify it and see. You'll see it, or you can take a swab, put it on with the liquid, our liquid paraffin prep, and you will see ear mites. And I always show these ear mites to the client. And ear mites are best, as you know, they are mites. They are best treated with ivermectin, and Ivermectin is available with Intas. So you have to be really careful with the dosage, though, because it is 200 micrograms, okay, per kg body weight. You can use it to dose it orally. Also, you can make a liquid. You can crush the pill, and you can or you can take the liquid and dose it even in the ear. 1 drop of it will take care of it. But mostly oral neomec works very well for ear mite infection. And for steroid also, as I said, that because of the inflammation, external steroids are really important to use. So the list of steroid, in terms of efficacy is available. But then prednisolone is our drug of choice, which is given orally at an anti-inflammatory dose, half mg per kg to up to 1 milligram twice daily for about 3 to 5 days, and a tapering dose orally. And externally into the ear too, you can use instill, your betamethasone or your the drops like our the drops that we can use in the ears to, which I've got, and pain medication also. So I think the correct me, Dr. Ravindra, which is the anesthetic that is available in your eardrop?
We have a Pomizol eardrop.
Which is the anesthetic that's available in Pomizol?
Yeah.
I think it is lidocaine, right?
Yes.
Yes. Lidocaine is used as an anesthetic too, which can be, which will, and clobetasol is your steroid that can be used, which is available in Pomizol. So you can use it as a local, steroid application in the ear. Yeah.
Yeah. Thank you, madam. That was very constructive answer. I hope it clarifies the understanding. Another question is very basic, but yet it is very important to understand that which are the ear cleansers to be used, and how we can measure the success of ear cleanser.
A very good question, Dr. Ravindra. Yes. So ear cleansers, as you know, there are plenty of ear cleansers available, depending upon what condition there is. Okay. And mostly the pH of the ear is what's important. And acidic pH is preferred over alkaline, because that is what helps to reduce the bacterial and the fungal load. And so right from normal saline, warm normal saline, to lactic acid, to sometimes vinegar, diluted vinegar. And of course, you've got ambiflush, which is there, which is chlorhexidine tris irritate. These are, as I said, the safety efficacy of the ear. Just ambiflush is so good that even if there is, an accidental, you do not even know that the ear canal, the tympanum is perforated. It is not very irritant if it goes into the middle ear. So what is very important to know is the ear cleanser has to be used copiously. You have to tell all our clients, they try to buy one bottle and try to make it last for many months. They'll put it on some cotton and try to clean the ear from the outside. So very importantly, I teach them how to, fill up the ear canal, massage it out, and then allow the body to block to shake his ear. Wait for 10 minutes before you put your eardrops like Pomizol. Okay, you need to wait between the cleansing time and the eardrop time, because otherwise the eardrop will not work, because it will not stick onto the surface which has got the ear cleanser on. And it's important also, like I said, to send home, a sterile flush set with your client. Show them how to do flushing, because it's really easy then to do it. I mean, in the beginning they're scared, but when you show them how to do it and flush out, it agitates the ear canal and pulls out all the debris. And you need to show them how to keep the bottle of ear cleanser clean. Not to dip in other things, like the infected tube, or putting a cotton, cleaning it up, again put in the cotton, they'll dip it over and then use it. Then the ear cleanser will get infected with the material. So you need to also show them how to, maintain your ear cleanser as well.
Very right, madam. And you rightly pointed out that pH is very important. and also the time gap between the ear cleanser and the ear drops. It is very important. Yeah. Thank you. Yeah. So we move on to the very nearby relevant question that is it advisable to use hydrogen peroxide as a ear flushing?
No, not anymore. Not anymore. Those we used to use in our days when there was nothing else available.
Yeah.
Hydrogen peroxide is pretty irritant. Yes, it has got a very good capacity and it's very dramatic. You pour it and it foams out. Everyone loves to see jug coming out, foam coming out like a volcano. When there's, your and your drum is extremely sensitive. So it's not advisable at all to use hydrogen peroxide. When there's plenty of wax earlier, people used to use it to cleanse out the wax. But there are better, cleansers available nowadays. Which you should use, which are pH balanced and which are not irritant to any wounds that are already existing inside the ear. So definitely not.
Yeah, very right. Then when there was nothing was available, people, doctor, when used to hydrogen peroxide. But yeah, you rightly said. Now lots of product available, including one of the very good product, MB Flush, which is pH balance as well as non-irritant. Yeah. So we move on to our next question, which is very relevant to you as a being surgeon. That what could be the ideal management of dropped ear after ear hematoma surgery?
So the thing is, dropped ears are very difficult to manage. See, dropped ears, as I said, it's the cartilage. Ear cartilage is what makes the ear stiff, the scaphoid cartilage. And your hematomas, as you know, are the resultant of irritation within the ear canal and flapping, as you would have all told your clients that that is not the actual problem. The actual problem is within the ear. Okay, and when the ear hematoma happens, there's also a fracture of the scaphoid cartilage that happens. And fractured cartilages are really difficult to heal. I mean, so you should not try to attempt to tape it up or try to do something else, trying to make the ear canal erect again, because that's not going to happen. On the contrary, you must guide your clients who have got dogs with erect ears like Pomeranians, German Shepherds, who have the tendency to develop ear infections, that, if they want to maintain a healthy and a happy pet and a handsome looking, animal with ears, they start looking after the ears early, not allow a ear infection to happen. Cleanse out, clean, don't deep clean, but at least keep the ears clean regularly. Make sure that the wax is not built up, so that hematomas don't happen, and so they do not form dropped ear. So that's something that is preventable, not treatable.
Yes, that's very good, madam. Nice to know that now the veterinarians can now handle the situations. So we move on to our next question, that what is your favorite antibiotic or to treat the ear infections, particularly bacterial ear infections?
Yes. So essentially, antibiotics should be something that the owners can give properly. As I told, it's a very challenging thing for people to give medication to dogs, and something that should be dosed ideally once a day. And fluoroquinolones are really good there. Of course, fluoroquinolones also work very well, into the inside of the ear. Enrofloxacin, ofloxacin, like in Pomizol, it's available. The antibiotics are in the ear. But when there is, otitis externa with some, infection there, bacterial infection, and it is pretty severe with pus, best to use something like a marbofloxacin, which Intas has Marbomed, which you can do once a day. So you will be assured of the compliance from the owner, because 2 times daily, even we forget to give medication. So it's really a good antibiotic to use. It's just once a day, and people feel satisfied, that okay, it's just once a day. They think the work is over, and that should be done.
Owner compliance is very important. Yeah, I do understand. And as you rightly mentioned earlier, that Intas is always brings the innovative product. So this Marbomat is one of the our innovative product which is exclusively available with us.
Yes.
Right. So yeah. So we'll move on to this another few questions, and we end up the session. So, madam, some veterinarians want to know that which are the dog breeds which are more prone to the otitis particularly.
Yeah. Right. As you said, predisposing causes are always there.
Yeah.
So dogs with, say, when you look at otitis and the predisposing cause, dogs with allergies, so are very, very common with skin disease. So your Shih Tzus, your Beagles, these are now becoming now most popular breeds. Definitely, and not to forget Labradors, Golden
Yeah.
Retrievers. These are really prone to otitis. Our German Shepherds have a problem that they do have keratinizing defect issues, and sebaceous, they've got keratinizing defect issues also, so they're also prone to otitis. Dogs with narrow ear canals, like your Shar-Peis, and some of the these chow chows that we're seeing,
Yeah.
these have got really narrow ear canals compared to what they should be having. So this also predisposes to ear disease, So almost, I would say, most of the breeds that we're getting. So now the population is that, we've got a huge number of Beagles and Shih Tzus and Golden Retrievers. Well, they form more than 50% of our population. So all of them
Yeah.
are predisposed to ear disease.
I completely agree, madam. Right.
Of
So
course,
one very
not to forget, your floppy-eared dogs, Shih Tzus again, floppy ears, and these are also there, yes. Dachshunds.
Okay, that's good, madam. And one of few of our viewers want to know that how we can take the image from the otoscopic observation for the documentation purpose, particularly.
So it depends on what kind of otoscope you have.
Yeah.
So essentially, if you have a regular otoscope, handheld otoscope, that's a challenge. But you can use your camera nowadays, your digital camera, which we have our digital cell phone. We can put it there and take an image. But video otoscopy, therefore, that's the reason why I showed you that, because these are the new things that are there in the market. And people will ask you, because now, what happens is it's a demand from our clients. And people will say, I want to, why are you not doing otoscopy for my dog's ears? And what is the condition of my dog's tympanum? Is it broken? Because always they are very concerned about the eardrum breaking. So I think there are different handheld video otoscopes also available. You don't have to go for an expensive one like I showed you. Of course, that's a one-time investment, and that's multi-purpose, whatever. But I'm not here to promote STOTs or any of this. I mean, I'm not claiming that. I'm just saying importance of video otoscopy, importance of being able to capture images, and importance of use of technology that's out there. So you need to, if you have to look cut above the rest, and be able to provide specialized service, we have to learn to use technology. And that's the reason why I was showing you Dr. Rosichak. He is the expert on ear diseases, and he's the person who founded these deep cleaning techniques also. So this is the only way to, you can try with your cell phone, but it'll really not ever be as good as getting a video otoscope.
Yeah, very right, madam. And as per your view of perspective, we keep the sessions topic also like that it is advanced than the routine treatments. So yeah, it is very required. Technology are now upgrading us as a medical professionals, and we do need to use such kind of otoscopes and other instrument in our clinics day by day. Very right. The very relevant question to otoscope, madam. What is your view of which is the best otoscope available in the market, and what is the approx cost of that particular instrument or otoscope?
So of course, the best is always most expensive.
Yeah.
I could also you can there are video otoscopes available, which is available online. I think it is. I forget the brand I have. I know which I have, but it's available. We've got handheld video otoscopes available online. I think Firefly was one of those, if I'm not mistaken.
Okay.
And of course, you've seen Storz. They have it, otoscope mainly made for veterinary use. And the otoscope, of course, the entire instrumentation also is involved. So if you're a surgeon and if you're looking at going for more of a laparoscopy or endoscopy, then it's just a small add-on to your existing equipment. So you buy this and you buy everything else, that add-on. So I would say, by far Olympus, Storz, but Storz that goes right into the ear, and it's very easy to see. The vision angle is pretty good. And the best part of it is that you can use water fluid, it's got video otoscopy, so it doesn't have, so you don't have the chip at using flushing liquids into it is not going to spoil your otoscope, and that's really part of what you need to do. So in my opinion, I think Storz is really very good, the best I would say in the market.
Yeah, okay. Thank you very much, madam, for briefly answering all the queries and questions we could able to take. So for the viewers, we will release the certificate of participation on completion of our 3 webinars on ear affections. So this is our second on ear affections. And stay connected with us. Our next webinar, which we are planning on 26th of July, is on Sunday. And to get all the updates, please subscribe and hit the bell icon to get the updates of our Intas Petpod channels. Please stay connected through our channels. You will get all the updates on the webinars and upcoming sessions. We'll share the updates on email as well on time to time. So ensure you feed the correct information while you are logging whenever, right? So anyway, again, thank you all the viewers, and thank you very much, Dr. Lakshmi Madam, for your valuable time and brief enlighten us on the ear affections. Thank you, Madam.